Hi guys, Dr. Axe here. Let's talk about diabetes and really excited about this very new patented infusion that's working amazing when it comes to diabetes. But before we jump into that, let's just talk about what is going on and how it is a root cause issue. If I could treat anything to get to the root issue, it would definitely be diabetes. And so in 2017, we were spending 327 billion. And by 2030, that's going to double to 622 billion. And they think we're going to surpass that. That's how bad it's getting. So, I mean, it is a huge, huge problem when it comes to cost. So if you can treat diabetes naturally, that you're going to save so much money, especially in the healthcare system. And it's not just, oh, you have diabetes. It's an entire complex issue. And it's damaging all of our organs, damaging the heart, kidney failure, nerve damage, wounds, eye damage, retinopathies, right? Peripheral artery disease, stroke, skin conditions, depression, fatty liver, gut issues, obesity are all driven by insulin issues, particularly diabetes. So diabetes is not a separate thing. It is driving and causing all of these issues. So here's a couple myths about diabetes. That it always gets worse. It's genetic. It's got to live with it. Just take your medications and you'll be fine. The only organ in your body that is involved is your pancreas. No, there's 5 different organs. Diabetic drugs with normal fasting blood sugar levels have no complications. Just fixing the glucose number doesn't mean anything. It's just a number. That is not correcting anything. And it's really not even helpful from what we're seeing through the research. It's literally covering it up. The number looks better. People are actually still getting worse. Organs that control your blood sugar: pancreas, liver, adrenals, brain, thyroid. So this is why in functional medicine, which is where we're basically doing primary care, but much more in depth, we address the thyroid, we address brain function, the hormone and adrenal regulation, because that plays a huge, huge factor into blood sugar regulation. So that your entire body is monitoring and controlling this, not just your pancreas. Okay? So what a lot of diabetics, these are some of the big things that people are experiencing: taking too many drugs. The doctors want to give them more drugs. They just feel awful. They can't lose weight. They have no energy. Blood sugar levels are all over the place. Medications just aren't working or making them worse. Constant pain, no sex drive, forgetting things, memory issues. So those are some of the big things that diabetes is driving symptom-wise. So let's talk about, I really love this slide. This tells us exactly what's causing diabetes. Why are those blood sugar levels high? So right here on the top left, we see our stressors. It all starts with stress: emotional, physical, and chemical. Chemical stress comes from toxins, can be in our food, in our environment, in our air, and obviously, dietary toxins. So just because you're stressed out from work, right, and then you add all the chemical stress on top of it, and then you're sitting all day and you have bad posture and your back hurts, and then you add that physical stress, boom, 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 3 in a row, that causes insult to the body, okay? Or that damages the body. Now, insult to the body comes in. These are infections, gut issues, which then lead to decrease in hormones, and then the nervous system gets unbalanced from all the stress, right? So then the body gets damaged. And if your body is damaged, what does your body use to heal the damage? It uses inflammation. It's actually a good thing, because that's your response to get your body to heal itself. Think about inflammation like paint and spackling, right? If you damage the wall and insult it, then you need the spackling and the paint to come in there and fix it. That's all inflammation really is. So it's actually a good thing. The problem is that inflammation damages the pancreas and really causes an issue where the pancreas can't pulsate properly for your insulin and your glucose. And then when that happens, then at the very bottom here, this is when you get metabolic dysfunction, oxidative stress, okay? Then you get fatty liver, obesity, Alzheimer's, and then neurological, Parkinson's, dementia. Then you get cardiovascular issues, cancer, chronic pain, fatigue, autoimmune issues, arthritis. Those are all secondary. Again, this is why we don't treat these symptoms. We treat the stressors, we treat the insult issues, right? And then we use natural means to decrease inflammation. We go boom, 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 1, 2, 3. We clear that out. All the symptoms go away. Hundreds and hundreds of symptoms are treatable this way. So that's the cause. We got to treat the infections, the gut issues, the hormonal imbalances, the nervous system. And we have to make sure that we remove those stressors at the same time so your body can heal. So that is kind of our patented way through functional medicine program to actually treat this. However, the functional medicine does not get the pulsations of your pancreas back into rhythm. Okay? So that's the big problem, right? The insulin pulsations. And then sugar, because it's not pulsating, the sugar is not able to get in the cell. Okay? And because your cells are suffocating and starving, right? There's tons of food outside the cell, but there's none in the cell. So your cells are starving because of it. So the body says, I need food. So it turns to alternative sources for fuel. And when it does that, that creates a massive inflammatory response. And it's very inefficient, very, very inefficient. Okay? So, and when your cells are inflamed and your cells don't make energy, that creates, your body basically doesn't heal. Stomach lining can't heal, wounds can't heal, kidneys can't heal, etc. And again, that end result is high blood glucose. So that is a symptom that has nothing to do with the cause or the disease. It's just a symptom of this problem. So controlling the glucose is not the solution. Again, you're treating the glucose. That is the symptom. Stop treating the symptom. Let's start treating the cause. And that's what we're doing here. So this is how your body should work with glucose regulation. The green is your glucose, essentially, right? When it goes up, your body secretes insulin to pull the glucose into the cell, okay? And so they're opposite. They pulsate back and forth. One goes high, the other one goes low to kind of counteract. And so it should pulsate back and forth. Red up, green down, back and forth. And then it just keeps everything kind of in a tight control. And this should pulsate up and down like this every 4 to 8 minutes. It should not be flatlined. This is very similar to think about your circadian rhythm. Cortisol peaks in the morning, gets you up, gets you moving. Boom, it should drop at night so that you can go to bed and you can sleep properly. Just like you have a circadian sleep rhythm, you should also have an insulin glucose rhythm, right? So very similar. So they figured this out back in 1988. They showed normal pulsations of the pancreas and a diabetic, how the pulsations down here are totally off rhythm. So with the diabetes relief and the infusions, we're able to pulsate that back into rhythm, essentially. So here in the middle, you can see how the insulin is flatlined. It's not really moving up and down like it is here on the left. And in this case, glucose cannot get into the cell because the cell is very, very sad, as you can see. With the diabetes relief infusions, which is this peak right here, we're pulsating insulin in there so it's pulsated like the pancreas does. And once we pulsate that long enough over time, it will start to regain its rhythm and act normally. That's the whole science and the patent behind this procedure. Changing diet and functional medicine is amazing, but only diabetes relief pulsates things back into the proper rhythm and gets things working properly again in this fashion, okay? So again, here you can see in the purple, that's diabetes relief infusion. That's the patent to get that thing back into rhythm, okay? So this is going to bypass your failing metabolism, restore physiology, coordinate it, improve your insulin sensitivity, enhance glucose metabolism, increase energy production, right? Because if we pulsate this and then the sugar gets in the cell and you burn more of it, you're going to lose weight, you're going to make more energy. Your body's going to heal because it's making more energy. Think about a factory. All these parts are jacked up, nothing's right. And then you're like, well, the power's turned off. Well, of course the parts are going to be off because there's no power. You can't make or heal or fix anything. So quit looking at, oh, all these parts are not made correctly when there's no power to the building, right? That's why we have to start looking at this. We got to make energy and power. So let's talk about, now that you know the patent behind diabetes relief and how we're able to pulsate things back, let's talk about a little bit more the science of understanding insulin and glucose physiology. So really the way this works, this is a feedback loop where if glucose is high or if it's low, that pulsates and tells the pancreas what to do. With that information, whether it's high or low, the pancreas can pulsate the glucagon, insulin to the liver, and then the liver releases the glucose, glucagon, insulin to get everything regulated. So the pancreas is controlling that and working with the liver so that the liver can release glucagon into the bloodstream. Okay, so that's kind of how this system works. But key takeaway here is the pancreas has a neurological rhythm. And this is why I like to work on spinal health as well. We have a physical program, PT, chiro, to get people out of pain and get their neurological system, where we're balancing the posture in the neurological system. That can get the pancreas neurologically pulsating better. So there's definitely a big tie to spinal health and diabetes here. All right. So the patented approach here, we are using insulin as a hormone, which is how it's used in the body, instead of as a drug. Because with conventional diabetes treatment, you're given insulin flatlined, which makes things worse. Where we want to use it as a hormone and use it just as your body pulsates it, right? We want to mimic how your body does it, essentially. So, and by delivering insulin in this manner, we're mimicking that body's function. With improved insulin sensitivity, glucose can be more readily entered in the cells, converted into ATP and energy. Then you more have cellular energy. Your cells are healthier. Things can heal themselves. So again, cellular energy goes up. You can see here. So this is causing metabolic failure because you're the decreased carbs for energy, right? Your engine is not able to burn that gasoline and turn it into energy. So your cells turn to other things like fats, which increases oxidative stress and it impairs your immune function, which causes inflammation, which damages your vascular system, leading to heart disease and organ damage. That's kind of how this works, which I explained a little bit earlier. So by restoring this process in the body, neuropathy is going away, energy is better, weight gets better, erectile dysfunction, retinopathy, eye issues, medications reduced, blood sugar control gets better, wound healing, hair, nails start to improve as those cells have more energy. So it's some pretty amazing stuff. Here's a before and an after, someone's hair thickening. And this is someone that was just pre-diabetic. They weren't even diabetic. Okay? This is another patient. A1Cs went from 7.8 to 6.9 just in the matter of 30 days. So major fatigue, fissures in the skin, neuropathy for 2 years, all those things, complete return of sensation, dryness gone, increased energy. Vision is huge with this. Blurred vision, low energy, sleeping better, just countless testimonials here. We're not going to spend too much time on this, but you kind of get the point. Hair loss, uncontrolled blood sugar, neuropathy, all those things got better with all of these patients. Every single one that's compliant, does what we say, these things are pretty much, I can't say guaranteed, but pretty much guaranteed. All right, and this causes a major issue with the kidneys. And dialysis is $89,000 per patient annually. Kidney transplants are $32,000. Okay, so it's just, if we get diabetes down, kidneys are going to work better. So there's huge cost savings to our medical system by actually doing this. And this is eventually, over the next 5 or 10 years, this will become mainstream. It's just going to take, again, a decade to get this through our medical system and all the red tape, white tape. I mean, everything they got to get past and all the research. The research is there, but again, eventually this will be mainstream medicine. So we're definitely way on the leading edge of this. A lot of people ask, how do I know if I'm eligible? Well, if you're type 1, type 2 diabetes, or if you just have metabolic disorders, issues with your metabolism, which almost anyone can qualify for. Pre-diabetes as well. And again, so it could be non-diabetics with these complications, right? You might not be diabetic, but if you have neuropathy, retinopathy, nephropathy, skin issues, healing issues, erectile dysfunction, hyperlipidemia, obesity, fatty liver, stroke, Alzheimer's. If you have any of those things, you're going to qualify under those issues because those are all linked to the metabolism and this inflammatory response from insulin pancreatic regulation. So what should you expect, right? Energy, reverse, definitely sleep. The biggest thing I hear is people are sleeping better, okay? You're going to reverse all the complications that go with it, nerve pain, retinopathy. The duration is, you normally start 1 to 2 times a week to really get that rhythm back. Then you drop down to once a week, then once a month, then and then maybe get off of it. So it's definitely like a progression where we stair step you down once the rhythm and everything is working properly. That's kind of the duration of the treatment. This is an infusion treatment. We're using IVs and insulin and a patented pump to get this working again. And we do work with most insurance companies, especially Medicare, to get this as a covered service, which is awesome. And that's it. Thank you guys for learning. And if you're interested in the treatment, please get with us. We need to do an assessment. Make sure you're a candidate. We'll look at your labs, look at your history, and we'll kind of go from there, look at your insurance, and let you know.